How to avoid lower back surgery and continue strength training despite having agonizing pain when you try to lift weights. One of the most common things that I see in all of our social media, in our online coaching, is people come to me saying, I can't deadlift, I can't squat, it causes too much pain in my lower back. And people ask me things like, can I do back extensions instead of deadlifts? Can I do this exercise instead? And the problem with that approach is that you're avoiding the things that you need to be doing in order to make your back strong and resilient. Now, the more and more I go down this journey of teaching the unified movement system, which is what we teach in our online coaching, that's what UMS means if you didn't know, where we teach structural balance training, we overcome injuries for people and we get them, strong, flexible, fit, and able to continue training in their 30s, 40s, 50s, 60s. The further I go down this journey, the more validation I'm getting from people that are very, very noteworthy. And most recently, one of our online coaching tribe members, Paul, who I'm not even sure where he is. He's over in Europe somewhere. I think he might be up in the Slavic region of Europe, but I'm not sure. Paul, if you're watching, I know you often tune in on my live streams. Say hello, let me know where you are in the world. But he's an orthopedic surgeon. So, and he's, wrote this post in our online community recently, really validating everything that I'm talking about here, where I did a post talking about structural balance training and about why, if you get it right, you can avoid, having to get surgery. And he's chimed in and said, this is so true. He said, in my field, being an orthopedic surgeon, when you perform surgery on somebody, it is completely unpredictable what the result is going to be. There's often more harm done than good. It often leaves people in a worse place, and it's something that you can't undo. And structural balance training, getting your body as strong and flexible and balanced as possible, should always be your go-to. Now, let's talk specifically about lower back pain. If you didn't know, I am somebody who is no stranger to lower back pain. I turned 47 in 2 months. When I was 32 and I was serving as an infantry soldier overseas, I had a really bad fall when I was, had about 50 kilograms of gear on me. That's about 110 pounds. And I fell down a ravine. I fractured my spine. I have suffered a bilateral pars fracture in L4 and in L4, so bilateral both sides. And that deteriorated over the next couple of years into spondylolisthesis and spondylosis in L4 and L5. So any one of those three conditions is enough to cause severe lower back pain. And I was suffering badly. When I got out of the army, I had to take painkillers all the time. I was in really, really bad pain. I would have spasms a lot where I would have to, be bedridden for a couple of days until the inflammation went down. And I was forced to learn how to overcome this. And the one thing that I had that I don't even really know where I developed this mentality, but I just had a never give up mentality. Maybe it was something I learned in the army. Maybe it was something that I learned from my 13 years of practicing Kung Fu, but I just wasn't willing to accept that this was my fate. And I just didn't, like whenever I went to see, a specialist and they looked at my spine and they looked at the CT scans and they advised, like I've been advised to get a spine fusion many, many times by many different sports doctors and by surgeons as well. They said, look, you should get a spinal fusion. It's the only thing that's going to really fix you. And this is only going to get worse. It's not going to get better. And I just never accepted that. I just couldn't accept that in my 30s that was my fate, that I was somebody that, needed to get spine surgery. And so I went all in on just learning how to fix this issue. And when I say fix, I should clarify. When you look at a CT scan, I have spondylolisthesis, I have spondylosis, I have a bilateral pars fracture. It's all still there. So what I mean by fix is, I guess, learn to live with and learn to manage. And what I learned from working with exceptional sports physiotherapists and chiropractors was that I learned how to strengthen my body and how to live in spite of these issues. And now at age 47, I have no pain and I can do whatever I want to do without struggling, without having to, manage this lower back pain or anything like that. And it's because of the way that I strengthened and developed structural balance in my body. And one of the things that really surprised me when I fixed my own issues and I went on to my own training and doing what I do. And in Unity Gym, we built a physiotherapy clinic, a physical therapy clinic for those of you that are in America. And Yanni and I have befriended some world-class physical therapists who we offered them that they could work out of Unity Gym, out of our clinic. And we would have members that would come into the gym and, that were doing our group training, and then they would start to feel lower back pain, and they asked, what should I do about it? And we said, look, you should go and see one of the physios so that they can assess you and yada, yada. And then we'd watch them taking these guys through their sessions, and guess what they were doing? They were deadlifting and squatting. That's what they were doing in their physical therapy. And when we were asking them about, why is it that you do this? We see other physios, well, we don't see them, but we have our clients go to other physios and they come back saying that they can't deadlift, they can't do any of the stuff in the gym workouts, and they need to lay down on the ground and do these transverse abdominis activation exercises where you're pushing your fingers, into your lower abdomen, and you're trying to feel that your transverse abdominis is activating, where you're raising one leg and lowering a leg, and you may have done these kinds of exercises before, like really what I would call really dicky stuff that is taking, it creates this mentality of, I can't work out the way that I want to work out, and the only workout that I can do is this kind of physio exercises. And I'm asking them, why do you guys do it so differently? And they said, because deadlifting and squatting are two of the best exercises for overall strength, but especially for the lower back. They are not things that you should be avoiding. What we need to do is lean into it and to develop correct technique, because the biggest problem is load management. The problem that people have when they have lower back pain and when they have issues like what I've got, and you can insert almost any lower back issue. Like this same strategy, I haven't had this myself, but I've used the same strategy for people that have herniated discs, people that have bulging discs, and multiple other lower back injuries. And so what happens is you have this, when you have any issues like what I've just described, the tolerance of your lower back is far less than the tolerance of somebody, the load tolerance of somebody that doesn't have these issues. And so the problem lies in people not understanding how to manage load tolerance and how to train in a way that caters to what they can handle. And so what they do is they'll go into the gym, they see a lower body workout that they want to do, including deadlifting and squatting or whatever, and they give it a try. They mismanage load by either lifting too much weight or either doing too much volume, or, and almost always this is one of the things that they do it with poor technique. And then what happens is they exceed their load capacity very, very quickly with doing far less than what somebody that doesn't have problems in their lower back would do, usually their buddy or usually the other people that are in the class that they're looking at. And they have an episode where their lower back pain flares up, they go to a physio, they go to a chiropractor, whoever it is that they go to, and then they tell, this is what happened. I was at the gym and I did some deadlifting and bang, I had this spasm. And then the advice they get is, don't do deadlifting. Deadlifting is bad for your back. And it's really bad advice. What we should be doing is learning how to regress the deadlift, regress the squat to a version that's right for them, combine it in a program that creates structural balance, that balances left side to right side. Often there's an imbalance from left leg to right leg, so the right glutes are way stronger than the left glutes, and then they take over when you start approaching failure. And and then that's what causes the spasm. Imbalances between inner and outer units. So yes, there could be an imbalance between the deeper core muscles like the transverse abdominis versus the abdominal muscles, or the hip stabilizers like the piriformis and other deeper muscles within the hip versus the glutes. A weakness in the gluteus medius, the part of the glute that's responsible for that's partly responsible for hip stabilization, all these other things. So what we need to do is to train in a way that balances these things and that caters to the load capacity of the person with lower back pain. And this is such a common problem. It is something that I'm asked over and over again. And the reason I'm doing this episode today is because, again, I was asked in a comment on one of my posts on one of the social channels that we post on. I can't remember where, but somebody said, I get lower back pain when I do deadlifts. Should I stop deadlifting? And unfortunately as well, and I'm going to give a bit of a plug here, the solution from what I've found is not this is the exercises you need to do, or do it, or don't do it this way. It's that you need somebody who can guide you from where you are to being pain-free, because it's not just one jump, it's several steps. And I just did an interview with one of our tribe members, and I did this interview because he's had such an incredible result with lower back pain. He came to me to work with me because he has spondylolisthesis, and he saw one of my videos that were where I was talking about spondylolisthesis. And his stories, I'm sure that so many of you guys will be able to relate to it when you watch it, because his story is so familiar for almost everybody that I've worked with online. He said, I've got this issue and I have this pain. And so what I did was I went to YouTube and I started typing it in, and started looking for solutions on YouTube, and I'm getting all these fragments and, I'm trying this and I'm trying that, but none of it's really working. And when I watched one of your videos, I just thought, what have I got to lose? I'm going to join up and I'm going to start the coaching. And for the first several months of training with Anuj, there was so much back and forth with him where he was doubting what I was giving him, because I was telling him, we need to deadlift. You can't avoid deadlifting. We need to work on, the technique. We need to strengthen you up. We need to make sure you're doing it the right way. So we were doing things like hang deadlifts with just a dowel rod, meaning basically no weight, like just working on the movement pattern and not working full range of motion. A hang deadlift is where the bar goes to just below the knees and then you come back up. And then we were working on partial range squats. We were working on unilateral exercises, so where we're strengthening one side and then strengthening the other side individually. And then we progressively overloaded over time. And now, months later, he's deadlifting pain-free. He was talking about in his interview how he can, go out and do gardening that he could never do before without being in pain-free. Just like simple stuff that seems trivial, but when you've got lower back pain, when it's that bad, you can't do it. It prevents you from just doing these basic things that, people that don't have lower back pain take for granted. Being able to pick up his child and, carry his child around without having a flare-up in his lower back pain. Like things that seem, really trivial to those of us, or that we take for granted for those of us that don't suffer lower back pain. And it's because he leaned into these exercises that he thought were off limits and that he was trying to avoid. And he trusted this process. So, I'm going to give the shameless plug. If anybody is watching this, and you have severe lower back pain that you haven't been able to fix, and that you're watching yet another YouTube video to try and find the answer, try doing something that you probably haven't done before. Work with a coach like me who knows exactly how to fix it and who can guide you there and, get a result like many of the people who have, written Google reviews for us have had. And if that's you and you want to do it, go to unitygym.com, get started. You'll work directly with me. And if you're not willing to do that, then what I highly recommend is that you do this. First thing, get a diagnosis. Make sure that you don't have like a fractured spine where you've got a fragment of a bone that's floating around, that's, applying pressure to your spinal cord, that you're at serious risk of permanent disability. Then, that's a completely different story. So make sure that that's not what you're dealing with. And if you're just dealing with, I'm saying just, but it's not something that's going to end your life and end your ability to train. If it's herniated discs, if it's bulging discs, if it's spondylolisthesis, if it's spondylosis, if it's a pars fracture, none of those things are terminal. All of those things you can learn to live with, and you can continue to train pain-free and even achieve greater strength, greater flexibility, greater capability than you've ever had before. That's certainly what my experience has been, and what many people that I've worked with online have experienced as well. So if you're in that category, then you need to train for structural balance. You need to do a minimum of 3 program phases of structural balance training, where the focus of a structural balance training program is to create balance from left to right side, to create balance between upper and lower body, That's the second thing. Third thing is to create balance between the inner unit of stabilization muscles, like the transverse abdominis in your core, like the hip stabilizers in your hip, like the knee stabilizers in your knee, the parts of the quadricep that are responsible for knee stabilization, and balancing them with outer unit strength, the prime movers, the hamstrings, the quadriceps, the big muscles, the abdominal muscles. The abs, the rectus abdominis. So creating balance between those two, creating balance between strength and flexibility. You need a balance between those. A lot of people think that the solution to their problem is that they just need to get more flexible. That rarely is the case. It's the balance between strength and flexibility that we need. And then balance between opposing muscle systems within a joint. So balance between hamstrings and quadriceps in the knee, for example. Balance between hip extenders and hip flexors. So and then the program needs to be progressive, because what you need to do is you need to start with something that suits your capability at where you are right now, and then your body will adapt to that. And then after 4 weeks, usually, you'll need to progress to a slightly more advanced program. And that's going to be different for everybody. The version of the next program for every person is going to be slightly different. And then if you do that correctly for 3 program phases, and also during that phase, you're working on real technique optimization. The goal here in a structural balance training program is not about lifting as much as you can lift. It's about correcting your technique so that the fundamental lifts that you perform, the squat, the deadlift, the horizontal push pattern like a chest press, the horizontal pull pattern like a bent over row, the vertical push pattern like a shoulder press, the vertical pull pattern like a pull up, and the split squat pattern, that those 7 movement patterns, that you optimize technique in them so that as you progress to more advanced programming, that you're going to be doing it safely and you're going to be doing it with low risk of injury because you're not performing the exercises with poor technique. And then from there, when you've built that foundation and you can now deadlift with a light weight, you can squat with a light weight, you can do these exercises without this horrible fear that you're going to injure yourself straight away, then you start working on building some real muscle and some real strength, again, by using progressive overload and by moving through slightly more advanced programming phases where we start bringing in more bilateral movements. So by using barbell is a bilateral movement, by doing a barbell squat, like a back squat, instead of a split squat, which is going to generate far more force. It's going to produce more maximal strength. It's better for muscle hypertrophy, for things like that. So, that's the process of it. But the problem with all of this is, I'm giving you the theory behind it all, but to be able to actually put that into a program that produces the results for you, it takes a lot of understanding of how to write programming and how to assess your body. So, every single person that I interview with these online testimonials, which if you haven't watched any of these yet, because I know that you guys are out there and you're in this social media world, and there's, you're watching YouTube, you're watching Instagram, there's so many fitness influencers out there that are saying this and that are saying that, and that are, you don't know who to listen to. You don't know who is going to give you the advice that is going to actually gel with you. One thing I would say is this: I would be very, very careful taking advice from fitness professionals. I wouldn't take advice from anybody, virtually anybody that's in their 20s. People that are in their 20s haven't lived long enough to understand whether what they're teaching is actually going to stand the test of time. Because I can tell you right now, the way I was training in my 20s is what caused me to be so injured in my 30s. And I had to throw it out the window and learn a far greater way to train. So you want to be looking for somebody who has been training for a long enough time and who you can relate to their story, and this is why the content that I do is really about teaching people how, my brother and I have both overcome very traumatic injuries that a lot of surgeons and doctors will tell you you need surgery for. And we've overcome them. And in our late 40s, we're still thriving. We're still getting stronger. We're still in a body that's strong and robust and healthy. And I'm still able to train that I want. So that's something that you want to be doing. And you want to be training. You want to be looking at somebody who can produce the results that you're looking at producing. So I think a big problem is that, a lot of people are looking at people on social media to get their advice from that are in this elite level, that are showing you, methods about, hitting the highest level of calisthenic skills that are available, or the highest level of flexibility that is available. And the methods to get there are very, very different than the methods that are required for those of us, who are in our mid 40s or 50s or in our late 30s, and, who have children, who have demanding work, and who want to be able to perform well still in sport, but our bodies just aren't letting us get there for whatever reason. And we just want to be able to not start going backwards and go down this hill where these injuries and these aches and pains that are happening are getting worse, and we keep getting further away from those results that we want. And so it's good to have motivation to want to one day be able to do muscle ups, or to want to one day be able to do handstands and things like that. But if you're spending all of your time looking at getting advice from people that are like these calisthenic superstars, or these, elite bodybuilders, like it's a different journey. It's a different road. And the way that you have to, build your life around training to achieve those results is a very, very different way that you build your training around your life when you're somebody that has a really demanding life. And training is something that you can maybe barely fit. Like you intend to maybe train 4 days a week for an hour, but often there's weeks where you can't even do that. And maybe you can only train for half an hour or 40 minutes, or maybe you can only train 2 or 3 days a week. All of these things have to be taken into consideration when you're trying to write your program. And the reason I'm saying all of that, and I know this is a shameless plug, but the reason I'm saying all of that is there is so much mental load that goes into you trying to manage how you put all that into a program that actually produces the results that you want. And so if you want to get the results like the people that I've interviewed on my YouTube channel, if you haven't seen them, go and have a look at them, or the 330 people that have left 5-star Google reviews for us, then come and check it out. Go to unitygym.com and come and work with me, and I will work with you directly. I'll write your programs, and I'll provide coaching for you that achieves real tangible results in your life. Pop-Tart Cat Reacts, that's an awesome YouTube handle, is saying, "Hi Rad, how should I avoid structural balance on a day-to-day basis? I do a lot of chainsawing, which tends to strengthen one side more than the other." Cheers. Oh, structural imbalance. Listen, that's a really good question, and I don't think that you can avoid structural imbalance when you do something like that, where you're chainsawing and you're always, like you've always got one leg forward, you're always holding the front of the chainsaw in one hand and the back of the chainsaw in the other hand. The only way that you could really avoid that is if you did some chainsawing with the other hand. And I can only imagine that that's maybe not possible. That's like a tennis player saying, how can I avoid structural imbalance playing tennis? The answer would be, every second match or every second game play left-handed. But of course, they're not going to do that because they're far worse left-handed and they're not going to be competitive. So the only way that you can avoid these imbalances is that when you train in the gym, you train for structural imbalance. And it's a good question because it actually leads me to this. This is a side note, but this is very, very important. Tune your ears in for this one. One of the ways that you work to correct structural imbalances is that you train for the weak side, and the strong side matches the reps, sets, and weight of the weak side. So here's an example. If you're doing chainsawing all day, no doubt you're going to have one leg and one arm that's stronger than the other one. So when you do your split squats, which is a unilateral squat, unilateral meaning one side working the weight at one time, bilateral meaning both legs working the weight at one time. So the split squat, you would identify which is your weaker side, and you can do that very easily by just picking up the same amount of weight and doing reps on one side on the other, and you'll figure out very quickly which side is stronger than the other. So you always choose the weight and the amount of reps that you do and the amount of sets that you do based on the weaker side. So what does that mean? So let's say your left leg is weaker than the right leg, and when you pick up 10-pound dumbbells in each hand, you can just do 8 reps on the left leg before your technique starts going out the window and you really start failing. But then on the right side, you could hold 20-pound dumbbells in each hand and you could easily do 10 reps. What you do is you do the left side first and you do your 8 reps with the 10-pound dumbbells in each hand, and then you do the right side and you do 8 reps with 10-pound dumbbells in each hand. The left side will feel like it got its ass kicked, and you'll go to absolute failure. The right side will feel like you barely even did half of your capacity. But that imbalance will work itself out. The imbalance of the right side strength being here and the left side strength being here, it will start to go like this. And it will never be dead even, but it will get much closer to it. And if you do, on the contrary, what so many people must be doing, because I get this question asked all the time. People say, when I do my right leg and I do my strong side, and then when I do the left side, I can barely do half the reps. What should I do? So they're doing it the wrong way. They're training their strong side to failure. And then when they train their weaker side, they can barely do half of the amount of reps. They do it with poor technique. What you do there is you make the imbalance grow. The imbalance gets bigger between the strong side and the weak side. And an imbalance from left to right side is one of the leading causes of injuries. Because what happens is, when you're not thinking about it, and when you're, for example, when you're at work, if you do chainsawing, and I'm giving a hypothetical of what I imagine may happen at your work. So you chainsaw, and then there's a log or whatever it is, and you put the chainsaw down, and you and your co-worker, you go to pick it up. And as you go to pick it up, it's a max effort lift. You're lifting the most that you can lift. The left side cannot produce as much force as the right side in that moment. But all you do is try and lift. And so what happens is both sides produce as much force as they can. The right side lifts way more, and it pulls your body to the side as you're lifting a very heavy object, and then you get a muscle spasm in the left side. So what you experience is you go to lift and you go, and you have this spasm, and then you can't work for a couple of days, and you go into the chiropractor or the physio or whatever it is. So those imbalances from left to right side, and the same thing goes on in the upper body. Like if you've got one arm and shoulder that's way stronger than the other side, then the same thing can happen when you go to lift. And, so this is where, back to your question, how do you approach this? It's the way you approach it in your training. It's that your training needs to be built around structural balance, so that the training is designed to create balance within your body. I hope that answers your question, Pop-Tart Cat Reacts. And if you've got another question for me, let me know if you've got a follow-up question. David Wagner's saying, Pavel Tatsuin talks about following your protocol by using kettlebell clean and press and snatch. Yeah, right. Yeah. Look, structural balance training is interesting. It's something that not all coaches agree on. I've seen plenty of coaches disagree on structural balance training, but I completely disagree with them. The reasons as to why you would do structural balance training far outweigh the reasons why you wouldn't. And I've seen time and time again, I've been a personal trainer now or a coach for 20 years now, and I have seen time and time again that people come to me for whatever their goals are, and we start them with a structural balance training program for 3 phases, and it doesn't matter what their goals are, they in a very short amount of time say, my neck doesn't hurt anymore. My shoulder doesn't hurt anymore when I reach up. My shoulder doesn't hurt when I put my shirt on anymore. My lower back doesn't hurt anymore when I go out in the garden and do some gardening. And they didn't even come for those problems. They came because they wanted to build muscle. They wanted to look better for summer. They wanted to lose fat. They wanted to increase their flexibility, whatever it is. It happens time and time again. It is so, so valuable for you. So I hope you guys got something out of that. I started this episode, I was a little bit late today to get down here to do my live stream. I was dealing with my own family. I was having to be a dad, and it was something that I just thought in the last minute, I'm going to do this. LC Video or IC Video 101 is saying, does the strong side lose strength? That's a good question. And I want to think about how I want to answer that one. You've got to think about what's behind that question. So does the strong side lose strength? No, the strong side will maintain its strength. And you've got to think about this. Strength should be considered in what the whole body is capable of producing, not just what one side is. Like what use is it if your right leg can squat 200 kilograms, but your left leg can only squat 100 kilograms? Excuse me, I've got a hair in my throat. What use is that for your body? Whenever you try and squat, if you try and squat 200 kilograms and the one leg can't handle that, it's going to buckle and you're going to get injured every time you do it. So it doesn't matter that the right leg can squat that amount of weight. What matters is what your whole body can produce. And See, if you imagine if you said, if that question was, does the strong side lose strength? And then somebody argued, of course the strong side's going to lose strength. I would never stop training my strong side to its absolute capacity. And so you did what I described, where you keep training the strong side to continue using progressive overload to get stronger and stronger and stronger, and the gap between the two kept growing. Because what happens is, if you took that approach, I can almost assure you that most people that take that approach is what they say is, I'm not going to do structural balance training because I don't want to lose my maximal strength in my squat and deadlift. So I'm going to continue doing bilateral squats and bilateral deadlifts. And this is what happens. This is really important. When you go to failure, what happens is, if you're on a barbell with a squat, and I've seen this so many times, man, so many times, like this is what happens when you have a coach and you stand behind somebody and you see them as they approach failure. Watch this in the gym next time. Watch somebody next time you see them ego lifting. Stand directly behind them and you watch as they go to failure. Their hips shift to one side because the weak side cannot produce as much force anymore and they can't push the bar up evenly. And so what happens is, they go to push, the weak side fails when they get to the last couple of reps of the set, and the strong side takes over, and you see the whole hips twist to the side. And so in that moment, that is the moment when you are at risk of injury, and that is the moment where you think about this. If the majority of adaptation occurs in the last couple of reps of failure, which it does, if you didn't know that, if you're doing a set of 8 reps, then 90% of the adaptation occurs in the 7th and 8th rep. So if you're doing a set of 8 reps, the first 1 to 6 reps is really just to bring your body that close to failure that you get those last couple of reps in that cause the damage to the muscle fibers, which is where the adaptation occurs. Does that make sense? So if that's what happens, but in the 7th and 8th rep, the majority of the work is happening only on the strong side, you're just continuing to make that stronger side stronger and stronger and stronger, and the weaker side is just never getting that same strength adaptation. And enough of that over time is horrendous. It's a catastrophe waiting to happen. And if it's not a catastrophe that happens, if it's not an injury that happens, man, it looks weird. Like, you look at somebody that's trained this way, when they, stand just in your underwear, and you'll see like one lat is way huger than the other. You'll see one arm and one shoulder that's really dominant. Like, I've seen tennis players, I've seen amateur professional tennis players standing in front of me when they came to train with me, and I'm assessing them for their program. And man, you should see how jacked this one arm looks like compared to the other arm. Like, the other arm is just so much smaller than the one side. And then you see the same in the glutes and the quadriceps and the hamstrings. So it's, will you lose strength in the one side? Even if it is, it'll be such a small amount, and it'll be for such a small amount of time, because you can work out these structural imbalances relatively quickly. Most people can work out can get to within 80 to 90% of the same strength within 3 program phases. That's what we see with most people. And then you can start working on your max raw strength with your barbell squatting and your barbell bench pressing and all your bilateral movements again. And then what you can do is, the way that we address it then is, within each workout, your primary lifts are always the lifts where you're looking to produce the most strength. So once you've overcome the majority of your structural imbalance, you can maintain structural balance in your body by doing, for example, in a bench pressing workout, where hopefully you're pairing bench pressing and rows, so you're at least getting the balance between pushing and pulling. So you do your bench pressing and your rows. Hey, Ben, I can see my friend Ben just joined the live stream. How are you, brother? I'll see you on Friday. Hopefully it's not raining. We don't have to train at my place. So you'll be doing your bench pressing and your rows within the same workout, and those are your primary lifts. That's where you're trying to produce as much force as possible. And then what you do for your supplementary exercises is you'll do dumbbell chest pressing and dumbbell rows, single arm unilateral work, and that's where you can maintain your structural balance with it. Or if you're doing a squat workout where you're doing barbell back squats, You can do, Ben's waving at me. Hey, Ben. You can do you'll do your barbell back squats first. So that's where you're producing your maximal force. And then for your supplementary exercises, you'll do lunges, you'll do split squats, you'll do step ups, you'll do single leg hamstring curls, the exercises that create that structural balance. So that's how it all works. So I hope that helps, guys. I hope that answers your questions. We've had some great interaction on this live stream. I'm going to go. I'm going to get ready for my training now. This is when I do my strength and flexibility training. So I got to get ready for it. Keep those questions coming in. Hope you guys got value out of this. Tomorrow I'm going live for our online coaching tribe. So I'll be doing a live coaching call for them. So you won't see me online tomorrow, but I will see you again on Thursday. I know those of you over in the States and in Europe, that is going to be Wednesday for you. Right now it is Tuesday over here in Australia, so I know that we're ahead of you in the world. But thanks so much for tuning in. Thanks for giving me your attention, and I'm going to love you and leave you. Have a wonderful day.